just want to say thank you for coming out tonight, both you who are live in the audience and those who are on our webcast. Really appreciate you taking the time and being part of this. As mentioned, there's people who are going to be asking questions and following us by webcast, so just keep that in mind when you're talking and when you're asking questions. So tonight, the purpose of me really being here is to give a brief introduction to Lisa Bishop, who's going to be talking really about the meat of what our PharmD program implementation is going to be. As many of you know, we're moving towards an entry to practice PharmD program with the intent of graduating practice-ready pharmacists in today's environment. And there's multiple reasons for going this route, but Lisa will cover fully, and I'm sure it'll generate a lot of discussion, which is great. The intent is for you to be really inclusive in this whole process of moving forward. There will be a lot of opportunity for your thoughts and your suggestions as we move forward, both tonight, this is beginning the consultation phase, but throughout the entire process of implementation. So really appreciate your thoughts and your comments throughout. Please get involved and really share your thoughts. It's much appreciated. And as always, at the School of Pharmacy, we really, really value your input and we value your association with us. Many of you take students on rotation, teach for us, and do a variety of things. So we just want to say thank you. We don't often get a chance to say thank you, and so we're going to say thank you. Lisa will come up now and she will explain in great detail. Save your questions to the end, and then we'll have a lively discussion, hopefully over the things that Lisa has presented to you.
So thank you, and thanks everyone for coming. It's great to see everyone here, and I can't see who's viewing online, but welcome to you as well. And just to let you know, if you do want to provide any questions via the Twitter feed, just use the hashtag #MunPharmD, so that way they'll all come through and we'll be able to answer those questions as they come through. A copy of the slides are on the website as well, so for those of you who are following along online, but as well if any of you here in the audience want to look at the slides after they're there. So first, I guess in terms of disclosures, just to let you know, I am the director of the Entry to Practice PharmD program, so I do have a vested interest. I do work here at the school. This program is accredited for 1 CE, so the forms you should have as you came in. If you don't, you can pick one up on the way out, and as well the evaluation form at the end. So that's part of the accreditation process for that. So the learning objectives are here for today's section, which I'll just go through quickly. So a few of the things that we're going to go through throughout tonight is we'll explain a little bit of the curricular changes that are going on across the country in the different pharmacy programs. We'll talk a little bit about the difference between the baccalaureate and the PharmD programs. We'll talk some about the knowledge and skills required of the pharmacy graduates in response to the evolving change in pharmacy scopes of practice across the country. We'll explore a little bit the benefits and the impact of the PharmD training on the pharmacy community, which will be all of us. And we'll discuss a little bit about the options of adapting to the expanded scope, in particular for current pharmacists. So what options, if you're interested, of expanding your education. So in terms of the outline, in terms of the structure for today, I will talk first about pharmacy practice in Canada, a little bit about pharmacy education across the country and the US in terms of what's going on there. The impact on pharmacy practice, we'll talk about some of those events, education options for practicing pharmacists. And our consultation and feedback process. So this is one of the things that we're trying to reach out to the pharmacy community to get some feedback as we shape the new program. And we'll talk about a few ways that we'll do that. One of them is the survey that you picked up on the way in. That's the one that has been sent out electronically as well. You may have seen the notices through the panel website, things like that, the panel emails. But if you haven't had a chance to complete it there, you can complete the paper copy for us. And then we'll have the last hour of questions and answers, so we'll have lots of time for discussion during that time. So first to talk about pharmacy practice in Canada. And most of you are aware of this, so we'll just review this for everybody's benefit. So obviously, pharmacy has evolved over the past number of years. And there is a greater emphasis on the patient-focused role of pharmacists in terms of the expanding scope of pharmacy practice, the legislative changes that have occurred, and of course the regulation of pharmacy technicians, which allow then the pharmacists to do more of the patient-focused role. So this is a pretty busy slide, but you can see across the top are all the provinces and territories, and down the left-hand side are the different expanded scopes that are currently available across the country. So just to highlight our province, as you can see, we do have the ability to provide emergency prescription refills, renew extend prescriptions, change the dose and drug formulation, and make therapeutic substitutions. So we've been doing that for a while. Down at the bottom is administered drug by injection, which we're pending legislation for us to be able to do that. In the center there, those 3 X boxes, we can't do at this point, but some other provinces can across the country, and I anticipate within all the provinces these things will occur in the future. In particular, prescribing for minor ailments, initiate prescription drug therapy, and order and interpret lab tests. So those are the things I can see down the pipeline. So why is pharmacy practice evolving? Obviously, pharmacists have a more patient-focused role, and we know that they can improve patient outcomes. Pharmacists are often the most accessible healthcare professional. I mean, there are some pharmacies that are open 24 hours, so you can always reach a pharmacist. And given the healthcare resource constraints, many healthcare professionals have a more expanded scope so they can do more in their professions. So pharmacy is also one of those. So just to give a bit of background, in 2007 a working group was established of pharmacy organizations across Canada to form this blueprint of pharmacy, which essentially is a vision for pharmacy, what they saw at that time. And the pharmacy organizations consisted of regulatory, professional, advocacy, academic, and corporate representatives. So they really looked at where the profession should be. In particular, there's a section on changes within education and continuing professional development that they highlight. So I just want to highlight some of those points that they had in the blueprint. One thing that they spoke to was pharmacy education around emphasizing some of the foundational skills. So around communications, clinical decision-making, physical assessment, informatics, and research. So there are some of the things that they highlighted in that document. They also highlighted the need to incorporate more management, leadership, advocacy, and change management skills. To have more experiential learning, more interprofessional training, and graduates should be prepared to practice in expanded and innovative roles. So if you look at pharmacy education in Canada, right now the baccalaureate degree is 5 years, a total of 5 years. The entry to practice PharmD is a 6-year program, typically, and I'll get into in a little bit where they're currently being offered and where they're going across the country. There is an option for a post-baccalaureate PharmD, which is a 2-year full-time program. And then there's flexible bridging programs, which typically take about 3 to 5 years per time after you have another degree. And I'll talk about this more as we progress through the presentation. So looking at the education in Canada, the Association of Faculties of Pharmacy of Canada is the national nonprofit organization that advocates for the interest of pharmacy education in Canada. So in 2010, they had a joint resolution on the PharmD as a first professional degree in pharmacy. And a couple things that they highlighted in that report was that the current baccalaureate program can accommodate to the added knowledge and skills expected from pharmacists. So with everything that the pharmacists are now expected to do, the more patient-focused roles, really the baccalaureate program can accommodate that. We can't fit anything more into that. And they did say that all pharmacy schools should have a Doctor of Pharmacy curriculum in place by 2020 as the entry to practice program. And AFPC do have an expected set of educational outcomes for all entry to practice pharmacy programs in Canada. So that's kind of our Bible that we go by in terms of helping shape the curriculum and evaluating our students. So the bottom line with the educational outcomes is the overall goal is graduating medication therapy experts, which we know we all are. And those educational outcomes also form the basis of the pharmacy program accreditation. So if you're not aware, every school of pharmacy across the country has to have accreditation in order for us to continue to be able to graduate pharmacists so they can go on and be licensed. The other thing I wanted to highlight are the professional competencies for Canadian pharmacists at entry to practice. These are from NAPRA. And these help guide the outcomes, so the educational outcomes that we use, accreditation standards, and the national PBC OSCE exams. So that's something else that we look at closely. And I just highlighted this quickly in terms of looking at the AFPC outcomes compared to the NAPRA. And they do align, even though they have different terminology and different wording, the different outcomes do align. So they do emphasize patient care, communication, interprofessional collaboration, being a manager in terms of managing that practice setting, being an advocate, having that scholar characteristics of having the knowledge and research capabilities, and being a professional. So you can see how they both align both of those outcomes. And then our accrediting body is the Canadian Council for Accreditation of Pharmacy Programs. And like I said, they ensure that each pharmacy program does meet accreditation or does meet certain qualifications and educational standards in order to be accredited. So our program here at Memorial right now has full accreditation for 6 years until 2016. So we'll be going through this process again over the next year or so. And one thing that they do consider is both quality assurance of the programs and program enhancement. And program enhancement, one of those things will be moving to the entry to practice PharmD. So one of the big messages from that we have as a school is that the accreditation body will expect all pharmacy schools in Canada to offer an entry to practice PharmD to keep in line with what's expected from all the outcomes and the accreditation. So if we don't offer it, we won't get accredited, I guess is the bottom line there. So we look at some of the proposed changes in the curriculum as we go to the entry to practice PharmD. One of them is more interprofessional experiences. So that is through their students' experiential training, being able to have more of those experiences. Having more leadership training has been highlighted. Added skills in documentation of care, especially electronic documentation, has been highlighted. Having the ability for prescribing skills, as some provinces across the country have that ability. Monitoring of drug therapy outcomes, so actually monitoring the patient after we make those recommendations, so making sure that those occur. And immunizations. So when we look at program planning, essentially right now at Memorial we have a 1-year pre-pharmacy and 4 years in the program, so it's a total of 5 years. And that's typical for most programs across the country. So for the entry to practice PharmD, it will be a total of a 6-year program, so there's an extra year added there. We haven't exactly decided what we're going to do locally here yet. One example is having 2 years before they get into pharmacy and then 4 years in the pharmacy program. So that's one model that we're looking at. And we're going to be sorting out those details within the next couple months. There will be a greater emphasis on experiential training. So that's one of the biggest focuses, is getting those students practice ready so they have more experience, they're much more comfortable when they graduate. And further integration of material has been discussed as well. In particular, one thing that we've noticed is that students often learn in silos. So they learn, write the exam, and move on to the next subject. More integration is beneficial so that knowledge is carried throughout the program and they are be able to apply more and retain it and be able to use that knowledge. So if you look at the history of PharmD implementation, back in the 90s, the American Association of Colleges of Pharmacy in the US endorsed a change to the entry to practice PharmD. And over that decade, all American schools were offering an entry to practice PharmD. And in Canada, Quebec was the first one to switch over. So in 2007, the University of Montreal had their first entrance of students into their entry to practice PharmD. So they've been graduating students since 2011 with a PharmD. So like I said, Montreal already has the program implemented. Laval was shortly after that. In 2011, they admitted their students. And then in January 2013, Ontario announced their support of approval of the 2 pharmacy programs in Ontario, in Toronto and Waterloo. So that's what started getting the rest of the country looking into that, because if the 2 main schools in Ontario have it, then the other English schools across the country would follow suit. BC has just received approval, so they're going to accept their first graduates next year. And then the rest of us in our planning stages. So they're anticipating starting the program anywhere from 2016 to 2017. Here at Memorial, we're looking at a 2017 start if we get everything approved and everything goes smoothly. So we're going to have a couple years to pull all this together. So as part of our planning, we have been trying to reach out to various stakeholders, and I'll talk about that a little bit in the end, but in particular the pharmacist. And one thing that you may have seen is the pharmacist survey, like I mentioned earlier. Right now, when I pulled out the data last week, I had 80 responses, completed responses. And I just want to highlight a couple things in the preliminary, and keep in mind that we're hoping to get more responses over the next month, and so this may change. But a few things that we noticed, we did ask the top 3 areas where pharmacy graduates at Memorial are strongest, and the top 3 areas where they need improvement. So speaking as practicing pharmacists who are working with new graduates or people who graduate from Memorial. So a few of the characteristics that they felt the students were strongest, or the no longer students, recent graduates: communication, pharmaceutical care, and professionalism. And that's in line with what the faculty and staff feel as well, and I'll get into that in a second. We did have a faculty and staff retreat back in June, and these things aligned, which was interesting that we kind of had the same impressions as all the practicing pharmacists, which was great. Some areas that the graduates need improvement is around decision-making, leadership, and overseeing that practice setting. And we recognize some of those deficiencies as well, and we need to beef some of those up in the new program. So we want more input, more thoughts as we're planning this program from the broader pharmacy community, because you guys are working with colleagues and recent graduates, so this is very useful for us. So like I said, we did a faculty and staff retreat in June, and some things that we highlighted in terms of expectations of the graduates. One thing is that they need to be practice ready to provide the comprehensive care. So when they graduate, day 1, they need to be comfortable with the expanded scope, with being able to communicate with patients, with providers, just having that more comfort. And that's where we see the extended experiential learning will help with that, plus some other modifications in the curriculum. They need to be comfortable providing an expanded scope, like I mentioned. They need to be able to act independently and confidently. Right? Some students do like that initially when they graduate, and it takes a little bit of time to develop those skills. Having better written and verbal communication skills, so those things need to be helped a little bit as well. That critical thinking skills, so again, really be able to think critically, making decisions, not thinking, well, if it's not on paper, how do you apply that? So having that ability, we highlighted as well. And having more leadership skills. So that's another thing that we talked about, which came out in the Pharmacist survey as well, in terms of having the students being able to be more comfortable leading. So I just want to highlight a few of the differences between the BSc Pharm and the PharmD. The difference between the 5 years and 6 years, like I already mentioned. The prerequisites, so right now is a 1-year prerequisites, and we're looking to 2 years. There are some things that we've identified within the faculty and staff around chemistry could probably be a bit stronger. So there are things like that that we've identified, but as well there are other foundational things that they do need before they even come into pharmacy that would make them be able to take off better when they get into our program and be more comfortable. So we're going to be looking at that very soon. One thing when we look at the current program, most of the therapeutics are in year 3 and 4. We do start some practice a little bit early, but primarily it is later. One thing that we've discussed is having some of the therapeutics start earlier in the program. I know some of the other programs across the country that have already started with the Entry to Practice PharmD have started even in first year introducing the students to some therapeutics like osteoarthritis, COPD, some of those things, so when they go out and do their first work term, that they're able to start counseling on some of those conditions. So some common things that you're going to see in practice, and they're able to start using some of those skills. We do have some course integration right now, especially with our skills stream in particular, but we need greater course integration and better carry through throughout the program. So that's something with the PharmD will change. One of the big things is the practice placement. So right now in our program, we do have 24 weeks of practice experience. So the early to mid is 12 weeks. So that's 4 weeks after each year. And then the final clerkship is 12 weeks. So the difference when we go to the PharmD, it's required that we have at least 40 weeks for accreditation. So we're looking at 40 to 42 weeks of practice experience. We're looking at early to mid around 10 weeks, and then late for about 32 weeks. So it's primarily that final year that they're going to be doing the practice placements. So I just wanted to highlight the timeline. So right now we're in the stakeholder engagement phase. So up until the end of September, we're reaching out both to obviously the pharmacy community, we spoke to panel and NLPB, to the government, to various stakeholders or people that are going to be affected across campus. So this is really, we're trying to make those connections and get feedback as we're planning the program. So then over the next several months, we're going to be actually starting to put on paper the program planning. And we're planning to have a program, or at least a draft program, in place by next March on paper, and then we'll start the consultation phase again. So we will be going back out, getting feedback from the various stakeholders from the pharmacy community to get their input into what they think of this new program. We'll be doing the various approvals and revisions over that next year, and there's a lot of different stages throughout the university that you need to go to for the approval process. So it is a big endeavor that we need to do. With the final approvals by February of 2016 in order to get into the calendar, so that way we can plan the implementation part of it, and then the first submission would be September of 2017. So this next year, really, is, or really from now till next spring, is where we're going to be doing most of the program planning. So moving on now to the impact on pharmacy practice, which I'm sure you're all wondering about. I'm sure you have lots of ideas. So one of the big things is that with this new degree, the students will be proficient and practice ready upon graduation. So they will have more integration of that material, more practice experience, and the idea is that they will be able to start working with the skills to be able to provide the expanded scope and be more comfortable doing that. So that's a good thing. So obviously, we need more practice placements. So obviously, that's going to be an impact on the pharmacy community. So we need to develop more sites, and Wanda's here in the room. She's been instrumental at developing a lot of, well, all the sites for us, really. And we'll have started to explore more practice placements. We're looking at some international placements. We had some new ones developed last year that students attended. And the other thing that we've recognized, and we've had some feedback from some pharmacists, is really we want the students to be useful to the preceptors and the sites. So not just complete a manual or complete a checklist. They need to actually be there learning, obviously, we want them to learn, but also providing a service and learning through that and helping the preceptors. And the students should be coming with more independence and more confidence. That's the idea behind the new program and trying to instill that in them and give them those skills. The other idea is that students will provide continuous support. So rotations we anticipate will be offered throughout most of the year. Right now, if we look at clerkship, it's between January and April, and then the SPEs in the summer are typically, most of them are in May, so you don't have the continuity of service. If students are completing their, say, 32 weeks in the final year, we don't know for sure, we have to get approval through the university, but we're looking to have them start in May and continue that service until the following April. So having that, 12 months of the year, providing that final year placements. They won't each student won't be doing it for 12 months, but that opportunity will be there if a particular site wants a student continuously. And another thing is, hopefully the students, if they can provide continuous support, will be able to develop and maintain new services or education. So if you have a program that you want delivered to the nurses, if you're in hospital every month, the students who come every month can continuously do that and carry that service. Or if you have vaccines that you're doing in the fall, say the flu shot, then you want those students to come in for those 2 months, and that would be the rotation around giving the flu shots, right? So it depends on what your needs are and where you see the students fitting in. Students will have greater independence, like I said. They will have an increased comfort with the expanded scope of practice. They can provide useful services like the immunizations or other things that they'll have the capabilities of doing. And another idea we spoke about is having the senior students help supervise the junior students. So if you have a student in that final year, but you also have a first or second year student, having them do a lot of that mentoring and providing supervision to the students. And a lot of other sites across the country do that, and it tends to work very well, much like medicine does in terms of the different levels of residents and the clerks, so that same kind of idea. So preceptors do have access to some university services and support. So preceptor support in particular, we have been talking about developing our sites, and one thing that we're hoping to be able to incorporate into the new program is having a couple people hired to actually go out in the field and help develop these sites. So developing the sites, help maintaining them, if there's any issues with the students or the preceptors in terms of getting the sites established, things like that, we'll have that resource there. So we're hoping that will be part of the program. Right now, our preceptors can have access to the Health Sciences Library, information resources, and that's for educational purposes for the students. So as you're teaching the students and looking things up for the patients for the teaching purposes, then you do have access to that. And if you're not aware of that currently, Wanda has all the information around that. Another thing that we've been working on is the option for a university appointment. And I don't think the official title has been finalized yet, but professional associate or something to that terminology has been discussed. So you can actually apply so that you have that affiliation with the university. So it would be a short application process that you'd have to submit, and I believe that lasts, is it a 3-year term? Yes. Yeah, so a 3-year term, you would have that appointment, just reapply again. And the Newfoundland Labrador Pharmacy Board currently offers continuing education credits for taking students, if you're a preceptor. Currently it's up to 6 credits per year. We haven't had that conversation yet if that's going to change with the Entry to Practice PharmD, with the difference in the expectations of taking students or the experiential placements, but I anticipate there will be some arrangement there. Okay, so moving on to the advanced education options. So one thing that we do want to highlight is that the current pharmacist in practice, the Entry to Practice PharmD program doesn't lessen the value of your current education or years of experience, because that's invaluable in itself. And we've all done some kind of advanced education, whether it's self-directed learning, doing continuing education, reading things on your own for your own practice, doing specific courses. Some people have done a residency, master's, PhD, PharmD. So there are many different options that many pharmacists have done. I'm going to talk a little bit today about the PharmD, just because it's the focus of today's presentation. For those pharmacists who would like to consider a post-baccalaureate PharmD. So a few reasons have been suggested, or I guess there was a survey done and some reasons that came up of why people would consider doing a post-baccalaureate PharmD. One is to remain competitive in the workforce. These came up as reasons. Increased job satisfaction, so being able to provide improved patient care, so with those additional knowledge and skills, being able to do that. Being able to advance their clinical practice. Having more leadership skills, and having more research skills. And one other thing that was noted is that most people who are in education, management, or research have a post-baccalaureate PharmD compared to those who have an Entry to Practice PharmD or a baccalaureate degree. So what are some considerations if you're thinking about a bridging program or doing a PharmD? Tuition. So obviously it's not cheap to do that. And tuition costs do vary depending on the program, and we'll get into that in a minute. And besides tuition costs, there are potentially other costs associated with traveling, because some programs expect travel to the university for either doing some face-to-face learning or experiential learning, so doing the practice placements. If you're going to a full-time program and you don't live in a city that offers a full-time program, and the only one now that offers that is BC, you'd have to relocate, so that's obviously a big expense and a change. Even if you do a distance program, there is potentially some travel to the university, and completing rotations is another consideration. If you look at the US programs, some of those, or all of them, require that some of the rotations have to be completed in the US. So that means you actually have to leave your home and live there for 2 to 3 rotations to get those completed. So that's obviously a consideration. And of course, personal sacrifices. Besides all these other sacrifices, the time it takes to do all the studying and commitment to that is big. It's not to deter you away from it or anything. So I just summarized here in this slide the different programs that are available for Canadian graduates. So like I mentioned, the University of British Columbia does offer the traditional full-time program. I'm not sure how long it's going to continue, but right now they are still accepting graduates or accepting students. And it is a 20-month program. It's open to anyone across Canada. And the tuition cost is about $44,000 for the program. University of Alberta, they just started they call it a post-professional PharmD. So it's a full-time program for about a year after. And they're opening it up to current students in the program that can apply, or if there's graduating pharmacists who want to apply to do this, and it's, like I said, about a year program. And they're charging about $25,000. And I don't think their enrollment is very large. And it does say it's open to anyone across Canada with a degree, so that's an option. So I highlighted two of the university schools that are still accepting or still offering the program. So this is the non-traditional part-time PharmD program. They estimate about 3 years for completion, and that varies a little bit how quickly you get through the courses. It is open to anyone, including Canadian students or Canadian pharmacists. And the cost is approximate here, but that's the range that they estimate the tuition is, so upwards of $60,000 US. That doesn't necessarily cover off any of the additional travel. So some programs have more travel expected than others, including rotations in the US. So it is pretty costly. In terms of the bridging programs offered in Canada, BC is opening up a bridging program. It hasn't started yet, and the duration is about 3 to 5 years. Right now, they're only opening up to BC grads, so we can apply anyway. I don't think anyone in this room is graduated from BC. Well, you already have your PharmD, so you're not looking for that. And we don't know right now how much the cost is going to be. They did say on their website, though, they're first starting with BC grads, then moving to the western provinces, and then considering others. So I guess we're not considered there. Waterloo also has a bridging program, and they say it's for about 1 to 3 years, and that's because it's a relatively new program, and my impression is that they structured it to convert into a PharmD. So I think the 1 year, depending on when you graduated, and just pretty much completing that last year of experiential learning. But they're only accepting Waterloo grads. And we don't know the cost yet. Toronto, on the other hand, does have it open. Their cost that they're advertising is approximately $32,000. And like I said, that's open to Canadian, international. They have it wide open in terms of acceptance. So in terms of Memorial, we are considering offering the bridging PharmD. So we have had some discussions around that. So it looks like we're moving in that direction. And what our discussion has been, shaping it around a part-time flexible program. So it's intended for the working pharmacist. We anticipate it will be a combination of online. There may be some on-campus expectations as well for those things in terms of, injection administration, physical assessment, some things that you need to do face-to-face. And of course, the experiential component. Obviously, with the experiential component, we'll need other practice placements. So that's something else that we need to keep in mind. Now, if we open it up to other alumni, we haven't had that discussion yet in terms of who we would open up to. Would it be just alumni or pharmacists in the province, or open it more widely? Depending on where they're living would determine, I guess, where they would want to do their practice placements. So they're not necessarily all in St. John's, is my point. So in terms of feedback, So like I said, we have had stakeholder meetings, like I mentioned already. We're having a similar event at the panel conference, similar to this one this evening, so we'll be able to reach out to more people there and get more feedback. We are having a student event that'll be next Monday, September 15th, so we're going to have a session for them to discuss their concerns and their feedback. And on the website, there is a section for the PharmD, so there is a tab on the website, and on that there is the link to our survey, like I mentioned, but as well there's a section there if you just want to provide feedback. So anytime you have any questions, any feedback that you want to provide us throughout the whole program planning process, please enter it there and I'll get that feedback and respond to you. So that is very helpful. And of course, as we're progressing through, like I mentioned before, we will be doing ongoing consultations. So we will get feedback from the pharmacy community and others as we're starting to get that program on paper and starting to plan that. So what we're looking from you as pharmacists mainly is letting us know the strengths of graduates and strengths of our program, as well as areas of improvement. So we've identified some of these, but we need to hear from everyone else in terms of your perspectives, because that will really help shape our program. And obviously the two main places that will ensure the quality program is through the curriculum content as well as through the practice sites, so the practice placements. So we've already had some discussions around the types of practice sites and what will be expected of the graduates. We anticipate there'll be some hospitals, some community in that advanced placement time, but also some elective rotations. So we've talked about research, some management, some different areas that we may be able to offer the students, depending on the students' interests. Some international sites are in there as well for that experience. So we're looking to more ideas of where we can develop some of these sites that will be valuable for the students. And of course, we want some feedback in terms of the interest in the bridging program. If this is, if you're interested in doing that, some ideas around that, all that feedback is valuable. So like I said, provide us feedback through the website. Please take some time to complete the survey, both to the people in the room and the people online. That's very helpful. And you can come to the panel presentation. And contact me anytime. So I'm open to feedback, suggestions, anything that you have that you want to pass along. I did want to highlight to those who are viewing via webcast that this is a credit for 1 CE credit that's valid until next year. So the presentation is going to be archived as well on the website. So if anyone views it over the next year, they will be able to get a continuing education credit for that. All you need to do is email me and I will send you the record of participation. And now I'll open it up to questions. So if anyone has any questions about the program. And we have some nice students here who are going to come around with mics.
Oh, thanks, Dr. Bishop. I think certainly the enhanced practice component of the program will certainly enhance our vision and our profession out there, and especially when we're dealing with insurance companies and governments and the general public and our patients in enhancing our practice of scope. Just wondering if there's any provision there too for enhanced business management throughout the program, and could you clarify the number of years? Was it 6 years or 2 years MUN or 2 years university plus 6 years for a total of 8 years?
Okay. So in terms of the duration first, to cover that part off, it's a total of 6 years. So we're looking at one model of a minimum of 2 years before pharmacy and then 4 years in the program. And as you know, even now currently, where it's a 1+4 program, some students come in with varying levels of, or varying amounts of pre-pharmacy years. So some people have a degree before they come in, but the minimum would be a 6-year program. So it's an added extra year. In terms of that part, in terms of the management, we have discussed that a little bit amongst ourselves at the faculty, recognizing that some students would have an interest in that, and even we've heard that some students going out to practice who do go down that path may not be necessarily comfortable with that in the beginning. We do have a pharmacy administration course, but I don't think it necessarily prepares them for that role. So we will discuss that amongst our planning. If you have any feedback, we can talk about it later. You can provide some feedback if you have any ideas of how we can do that. But as well, we did discuss even having one of the elective rotations for the students of having some kind of management administration type of rotation, so they will be able to get those skills. So we have actually spoke about that as well. Does that answer your question? Okay.
Yeah, I had a couple of questions. I'm doing a postgrad PharmD now at the University of Florida, and you're right about the expenses associated therewith. You have to travel there once a semester. But one of the most beneficial things I found from that program is doing the courses are organized as body systems. So they have a course that's foundations, and then after that you just start in body systems courses. So for example, cardiac, respiratory, and they integrate the kinetics, research, everything. Well, everything is research. All your case presentations have to be primary evidence. You have to use guidelines. And if you don't, you're asked, what do you think, for example, this is Mr. Circulatory. Okay, so what did JNC 8 say about that? And is that controversial and why and stuff like that? But I was just wondering if there's any thought in organizing that way. You did talk about having further integration, but for example, as opposed to having a kinetics course, to have a body systems course, because I found that really useful.
So thanks, Brittany. So we've started to think about that. I know some programs across the country have done some full integration. So starting from day one and incorporating the medchem, the kinetics, everything with the therapeutics. And my impression when I've been speaking to people across the country, there are some pros and cons to that. It is beneficial. I mean, some cons is that as they progress throughout the program, they forget some of the stuff that they learned earlier because it's all integrated. Some other cons is that some students, if it's all taught together, may ignore one particular portion like medchem because it's only 10% of the exam, so they cut their losses and completely miss that. So talking to some other people, some other kind of models that have been suggested is having a little bit of basic foundation in some of those pharmaceutical sciences and then doing some more integration throughout in those body systems type of model. So there are definitely some things that we've been thinking about and that we're discussing amongst ourselves at the faculty, but that kind of feedback is helpful for sure.
I just had a question, Lisa, about our practice sites. Within Eastern Health now, we are trying to expand our roles and expand our clinical services. And I know that we'll be needing that in order to take more students and to give them better placements and better education. Has there been any meetings within the healthcare authorities on how we can, I guess, meet these needs that we can see coming down the pipeline?
So thanks, Heather. So that's an excellent point. So we definitely need to meet with the health authorities. We haven't specifically met for the entry to practice PharmD as of yet, but that's on my list. So that is something that we're going to be reaching out, talking more in depth with them about establishing the sites and where the students can fit in and what kind of benefit they can play, for sure. So yes, that's...
There's probably even opportunities for students to come in and help develop the practice sites to a certain extent. So that's another area that we would be looking towards, having the students come in and supplying the evidence for, establishing those practice sites within the health authorities.
Definitely.
Lisa, is the funding in place to do this? That's the big question, because somewhere along the lines this is going to cost more money. And money is tight in the pharmacy world these days.
Yes.
So I'm just wondering, is funding in place to move forward with this on your timeline?
Do you want to take that or me?
Yeah, I can take it. Okay. So we have the funding in place right now to plan and implement. We will need some extra resources as we move forward, as we, we've made reference to a few positions that we'll require in order to properly develop our rotation sites and to follow up and make sure that they're quality rotation sites and to assist our preceptors. So those are conversations that we're currently having with our funders, who are the government. And we anticipate, they understood our need for resources, so we anticipate that as we move forward, we will acquire this additional funding that we need. But a lot of our faculty are in place right now. So we are actually sitting all right now. We will need some additional resources.
Just a couple of questions. I know you said that the rationale for moving towards an entry to practice PharmD is because there's just no time within the current curriculum to get all these expanded scope skills to the students. But yet a lot of schools across the country are still looking at only 4 years in the pharmacy program. So how are we getting all those skills with still the same 4 years? So that was the first question. The second question, I was just curious, what's happening with the residency programs? I know in Ontario, they have so many of them, but now they're doing entry to practice PharmD. Are they no more? Are they phasing them out? Just curious, I haven't heard.
Okay, thanks, Jennifer. That's a couple good questions. So in terms of the 4 years, and that's a good point in terms of it's still 4 years in the pharmacy program, but the idea, if they do 2 years before they get into pharmacy, they'll have a lot of more foundation courses done. So even in the first year of pharmacy, some of the things that they can do, or some of those electives, can be done before they get in. And giving them some additional skills and knowledge before they get in, so that way when they come in on day one, they'll have a lot more of that foundation so they can jump right in and start learning. And the way we'll structure it and evaluate the students will be a little bit different. So it won't be necessarily all, and we don't necessarily do all that now, but there'll be less of just memorize, writing a test, and moving on to the next subject. There will be a lot more of that integration, application of material, and incorporating a lot more into their learning. So we anticipate they will have more of that knowledge and skills. And as well, having that last year is very valuable in terms of having them that on-the-job learning, which develops most of the skills that they have in the comfort and the confidence that they need. So that's kind of the idea behind that. To answer your second questions about the residency programs. So I'm not 100% sure what's happening, but my understanding is that they're looking now to have the post-PharmD residency programs. So I think that's the path that they're going down. So it's still following the entry to practice degree, but it now will be entry to practice PharmD. So that will almost differentiate the entry to practice PharmD students who graduate versus everyone else in terms of still having that residency option afterwards. So that's my impression of what's going to happen.
And there'll be even some more opportunities post that. So the PharmD puts you in a different category of healthcare professional. So as you progress forward, let's say you wanted to do more research or things like that, that automatically gives you access to things like CHR fellowships, Canadian Institutes of Health Research fellowships, that you could go on and get some research training funded at high levels, like as if you were a physician or someone with a PhD. So there is some, it does afford some opportunities for career development.
Oh, Heidi.
We have a comment via Twitter. This is from Sue Kellen Dyer. She says, it is important that community pharmacies remain viable, particularly in rural areas. If that does not happen, then increasing scope and education will not be fully utilized and equally available. I guess that's a comment rather than a question.
Right. And yes, that is something that we're aware of in terms of we give the students all this training and education. It depends on the practice side of where they're working, if they're able to use all the skills and knowledge that they're given. So that is a valid point for sure. Was there a question? There wasn't a question associated with the comment, yeah.
Okay, I had more questions about the experiential side of it as well. And I do agree with the comments that, like, we'll have to, I guess, develop with the health authorities as well what's available in terms of clinical. One thing that I found really useful, again with the Florida PharmD, is the way they had it structured, it's competency assessments, and they have evaluated it again. I know Kathy Paulson's under the new program, so she could probably explain that better. But the way we did it was you had your group of patients that you had to follow, but you had certain competencies that you had to meet, like you had to do care plans for a certain amount of patients. You had to interview a certain amount of patients, and I found that again really useful because you're expected to apply all that stuff that you learned and do up like actual like comprehensive care plans. And so I was wondering how those are going to be evaluated. And also, I wasn't sure if this was thought of. I understand under the new experiential program for University of Florida, one of their CPAs, their competency assessments, is to join an advocacy organization of some sort, or at least like attend a meeting. I'm not sure what the exact requirements are because they recognized the need for advocacy. And so I was wondering if that's something you'd considered, because having had been part of, like I was really involved with CAPC and Bonn, and then involved with panel and CSHP, like if that, because that could be something that could be valuable early on.
Thanks, Brittany. So a couple of things in terms of the competency assessment. So I appreciate all those comments, and that is one thing that we're looking at the school. We haven't actually planned the program yet, so we don't know exactly how we're going to do that, but that's definitely on our radar and something we're going to look at. And we'll probably, like you mentioned before, we'll pick your brain in terms of your experience with your program. What's the other question again? Oh, the advocacy thing, right, sorry. So that's a great idea. I haven't thought about that part of it. I know one thing that BC has or will incorporate into their program that we've been talking about is a service learning day. So every student, so every year they'll have one day where they don't have classes, but it'll be a service learning day where they have to do some kind of service. So whether they're going out and to different organizations to shadow and have experience with patients, whether they're attending, say, research presentations, whether they're shadowing in hospital, so those types of things. So the advocacy part of that potentially could play into that, especially for attending potentially advocacy meetings. But having that membership, that's a good suggestion as well. So all these ideas are fabulous. So if people have more, please share or provide them to me afterwards. Jacqueline.
Lisa, I'm just wondering if you guys considered about class size. Would it be the same as the program currently is, about 40 students, or will that be changing?
So right now, we're planning for 40. And we like 40. In the MUN enrollment plan, there is an indication that we will go up to a class size of 50. We did get some funding a few years back to expand the program, but we did have some limitations in terms of space, so we expanded some of the resources and faculty and staff within our school, but we didn't have the space to expand. But then the landscape across the province and the country has changed a little bit in terms of the need for pharmacists. And as well, now our focus is more on developing the new Entry to Practice PharmD. So right now, we're at 40. There is potentially, we may go up to 50 in terms of if we look at the MUN enrollment plan.
But it wouldn't be anytime soon because we have nowhere to put those extra 10 students.
Right, so we still don't have the building to house those students.
We have another comment from Twitter, again from Sue Kellen Dyer. She says, it is very hard for small rural pharmacies to embrace all the opportunity when they are fighting to stay alive. So if you could address that comment.
And again, it comes back to the sites and the abilities and recognizing that there are limitations in numerous areas that pharmacists do work. And we do recognize in some of the rural, smaller pharmacies, that is challenging, even in terms of recruitment and getting pharmacists. Sometimes that's a challenge as well. So those are definitely challenges that the pharmacy community will face. I guess that's above in terms of what our abilities are as faculty and staff in terms of being able to change that per se in the pharmacy community. The only thing is, are the students able to help facilitate some of the development of services and things like that in those sites, would be my only thoughts.
Yeah, and as scope of practice changes roll out, then the appropriate compensation models need to be advocated for. And we certainly can, as a pharmacy school, we certainly can do evidence generation around those kinds of things. We have a very active pharmacy practice research group, and we certainly can be looking at pharmacy policy and investigating what reimbursement levels should be for that. So, once those things are established, having students within your pharmacy might actually increase your revenue stream in those regards. But there's some work to be done, definitely, for the reimbursement to come around.
Thank you, Lisa, for your presentation. I just have a question around the experiential example you provided about immunization times, for example, with students, and being useful having students there at that time. So do you anticipate any modification in licensure for students? Would they be able to do that sort of thing before they were actually licensed as a pharmacist? Currently, there's very little the student can do independently, even as much as recommendations they make currently has to be run by us. So I just wonder if there's been any thought around more freedom for the student, I suppose, or if they could do things like immunization before they graduate and have a license as a pharmacist.
Right. So, thanks, Andrea. So that's an excellent point, and I've been thinking about that in terms of speaking with NLPB, in terms of what their abilities are, because I know some other provinces, Ontario comes to mind, in the final year the students have a bit more leeway in terms of their abilities as long as there's a pharmacist in the area. So those are some conversations that we need to have with NLPB. In terms of the immunizations, I'm going to ask Carla to come up and just speak briefly, because I remember I remember talking to you before about the immunizations and the ability of the students to be able to do that before they graduate, and you know a bit more about that.
So we're still very early on in developing our immunization training and teaching, because officially pharmacists in Newfoundland can't do that yet. But we have had those conversations about, as a school, we'd like the students to be able to practice that under supervision of someone who is a pharmacist, to be able to do that. So those are definitely the considerations that we've had to make them more practice ready in their final years. So we've been considering that and had those discussions.
And it certainly is in existence in other jurisdictions. So like for BC, for example, when we rolled out having students vaccinate, right on the front cover of our university magazine, there was a pharmacy student who was actually vaccinating with the flu vaccine the president of the university. So, there is definite opportunities like that for us to raise our profiles, having students participate in things like that.
Any other questions?
I just have one more quick question. You mentioned that there's more opportunities for PharmD graduates now, or to be PharmD graduates, to avail of CIHR funding, whatever, research fellowships. But in the past, Bachelor of Pharmacy graduates would go on to either do residencies or PharmDs, and that's what would differentiate them. So now what's the existing PharmDs? Like, how do you differentiate yourself now when the PharmD title is everybody has it?
So that's a good point. So you're referring to people who currently have a bachelor's and then do a post-baccalaureate PharmD. So there is no different designation. So that is one thing that we've talked about internally. The only difference is if you actually list your degrees you have, you can see if you have a post-baccalaureate PharmD versus you don't have any other degree. So that's really the only way to know what your training is.
and not just like about putting it on a resume, but like if you're, as a PharmD graduate now, or a entry to practice PharmD graduate, how do you differentiate yourself if you did want to move on to advanced roles? Like there is no advanced pharmacy degree, I guess is what I'm saying. We're getting the advanced pharmacy degree from the start, so there's nothing to advance to.
Well, Carla and I are going to beat each other up about who's going to answer this question, but so I'll go first and then Carla can go after. Yeah. So there's a couple of different ways that you can differentiate yourself to be sort of that advanced level practitioner. So one of them is to do residencies and or fellowships and things like that, or advanced research training. Really depends what your career path is. If you look at, the United States has been offering entry to practice PharmD programs for, 20 years or more. And U of T is like this as well. They actually are offering combined degrees. So for example, at the University of Toronto, when we were talking about management training, they offer a combined PharmD MBA for people who want to go into that stream. And there's combined PharmD law degrees from various, so you got to consider other opportunities like that to differentiate yourself. But certainly the pharmacy stream, one path could be, you want to be an advanced level practitioner, would be to go do your PharmD, do a residency, and perhaps do a fellowship to give you that research experience, plus or minus a master's or a PhD. Now Carla can.
Oh, sorry.
So we've had these conversations at AFPC. We've talked to the residency board about where does residency fall in this place. So an example that we have in place is that in Quebec, as Lisa mentioned, that Montreal has been graduating entry-level PharmDs since 2011. So some of the models that they have is that now it's looking at doing a residency, a year 1 residency, and then a year 2 residency. So those are sort of the models that are evolving and currently in place. So there is an advanced training for people who are looking to go through more patient care sort of models on top of the ones that Dr. Mara mentioned.
Hi, Dr. Bishop, just follow up on an earlier comment that came through. I know of 3 community pharmacies that are going to be closing their doors in the next few months, unable to sell their businesses. They're simply going to close their businesses and try and sell the real estate. So obviously this will have an impact on helping out with the school and also for placement for students as well. Dr. Locke, in his report, he did 2 reports in the past 5 years, and that was some of his conclusions, that you're going to see a gradual erosion of community-based pharmacies because of all the drastic cuts that happened from the government and right down through the insurance companies. So certainly important to keep that in mind. And I know Dr. Mara, you said about trying to provide any kind of support for the community pharmacies. I know you can't do that monetarily, but it certainly it is going to be an impact on the whole pharmacy community with these closures because of the heavy cuts that have been done unilaterally by government.
Yeah. I mean, that's definitely unfortunate, and thanks for providing that. Oh, I think that's on, Brittany.
Okay. Well, this is probably not a fair question because it's far into the future. But because I'm getting close to graduating my PharmD program now, a lot of my fellow students in the US are talking about doing something called a board certified pharmacy specialist exam. And it's common enough that there's a new textbook we have to buy and the profs are like, oh, don't worry, you'll need it to study for your BCPS as well. So they're doing year 1 residencies and year 2 residencies. And I was just wondering, you were talking about the Association of Faculties of Pharmacy, has that discussion ever come up? Because there are certain pharmacists here that just through practice have become more specialized. Is there going to be any recognition for that? For example, they have geriatrics or oncology, or I'm not even sure of all of them, but they do an exam to be certified.
Right. I'm not aware of that in Canada. Do you know, Carla?
So Canadians can write that exam, and many have. And there's also an ambulatory care one as well, which is sort of analogous to the board certification one. And they're very useful, and they would be reasonably easy to pass if you review the information. A lot of people where PharmD programs have been around for a number of years have done those. So in BC, a number of people are board certified. Yeah, that could be an example. I don't know if it's carried a lot of weight in terms of, but it does give you expanded knowledge. Yeah. There's a question up there.
This is a comment about the BCPS. The BCPS is only done in the States because entry to practice PharmD has made everybody equal. So they're looking for an extra credential to differentiate themselves. But even now, BCPS is becoming it's a JNC standard, so, or not a JNC standard, a JCO standard, whatever it is the Americans have for accreditation. So BCPS is only something they're doing because they have to do. Whereas maybe 10 years ago, it separated you from the pack. And there's BCPS for psychiatry, oncology, ambulatory care, and they're in the process of developing one for cardiology. But I don't think it will ever make its way into Canada, and it doesn't really, it's just a big fat therapeutics exam, that's all it is. It doesn't really add anything to your degree. It's just a requirement now.
Okay, thanks, John. Any other questions from the group? So I guess we'll close. Thanks for all that great discussion. Lots of great ideas, lots of great questions and thoughts. And like I said earlier, please provide feedback, even if there's things you think about as we're progressing through the planning, additional ideas or thoughts that we can think about and incorporate, please send them along. You have, obviously you're working in the field, so all that input is very valuable. So thanks everyone for coming. When you came in, you should have gotten, well, the pharmacist survey, like I mentioned. You can put them in the box at the back of the room as you're leaving. And as well, the record of participation for your CE credits and the evaluation form. So if you can complete that, that would be appreciated. And one of the students at the back of the room will collect that on your way out. So thanks again. And we'll be in touch now throughout the planning process in terms of further consultation and feedback from everyone.
Thank you very much. Really appreciate it.